Hi, Virginia. How are you?
I'm good. How about you?
Good. Did you have a nice Thanksgiving?
I did.
Good, good, good.
Thank you.
You're welcome. How about you, Vanessa? Hi.
Hello.
Hi. Did you have a nice Thanksgiving?
Yeah, got a sick baby.
Oh,
How
oh,
was yours?
it was okay. It was quiet, which is nice.
That's good.
Yeah. Hi. Hi, Cynthia. Sister Cynthia. How are you? How are you feeling?
Good.
You feeling good? Good, good, good. That's great to hear. Hi, Chitarius.
Hello, Miss Marvel.
How are you?
I'm good. How are you?
Good. Did you have a nice Thanksgiving?
Yes, I did.
Good, good. Hi, Kadishia.
Hi.
How are you?
All right. How are you?
Good. Did you have a nice Thanksgiving?
No, I got COVID, so I was in the house.
I'm afraid to do a COVID test. I think I have COVID, but I'm not. What am I going to do? Right? What am I
Yeah,
going to? I mean, I got a head cold over Thanksgiving and just, ugh.
it was different this time though, for sure. I just
What?
actually left the hospital.
Oh, God, what happened?
I was just throwing up and I had diarrhea. I really thought it was my appendix because I threw up like 12 times, but thank God it wasn't. I
But
guess
you
it was an
tested
effect
positive
from.
for,
I tested positive initially on Wednesday,
yeah.
and then
Has it gone through your house?
not yet. Thank God. I've been keeping my mask on and just staying in a
Yeah.
certain area. So
Yeah, I'm afraid to do a test.
yeah.
Like I said, what am I going to do differently?
Right. Well,
I
only
don't
thing
know.
for me is I got on campus classes. But
Oh, well, that's a problem. Have
yeah.
you let your I've got to do that for you guys. SE, thank you for that reminder. SE schedule. Who do I have here? Okay. Um, yeah, well, you can't go to campus yet, can you?
No, she said 5 days.
Yeah,
Gotta
yeah,
wait.
yeah. Oh, I'm sorry. I hope you feel better.
Hey,
All right. Let's see, it's 3:02, so let's get going. I'm missing quite a bit of students actually. Hang on, maybe Isha. No, we're just missing a couple of students. Okay. Um, okay, a couple things. So welcome to week 9. We're in the home stretch there, guys, right? Just got a couple more weeks. I know it's a really, really busy time for the term. I know it is with exams, HESIs. Um, let me pull up, hang tight. Let me pull up something because I want to give you guys, hang on, where am I trying to go? SharePoint. Bear with me. I'm trying to get your HESI schedules. I have those, I think, for the most part. All right. I'm going to share my screen in a second. I'm just working on pulling it up. Have any of you have any of you heard from your Faculty access. Composite
No.
exam schedule. All right, hang on.
No,
Yes.
but if you go register for it on Evolve, then it tells you the date. And
Yeah,
I already
that-
registered for them, so.
right. That's what I'm trying to get you guys. All right. So let me. All right. So if any of you heard from your campuses about when your HESIs are scheduled, all right. This class I have Cuyahoga Falls, Orange Park, Pensacola, Port St. Lucie. I apologize for my raspy voice. I have a bit of a cold. So let me. Now, I'm only providing you dates. Okay. It's up to you to get with your campus to figure out how they want you to sign on. As far as I know, all of your campuses, you're taking it on campus. All right. So let me pull this schedule up and see if we can get you guys some schedules here. All right. What do I have? Cuyahoga Falls. Let's see if I can pull this up. Okay. So Cuyahoga Falls, there's when yours is going to be Monday, December 11th. So write these down. Who do I have from Cuyahoga Falls? Cynthia? Cynthia, you might be the only one. Yep. So Cynthia, yours is going to be scheduled on the 11th at 8:00. So make sure you get scheduled for that. Next is Orange Park. Okay, let's see when Orange Park. This is the master schedule, so I'm just trying to pull up. Okay, so it looks like Orange Park again on Monday at 3 p.m. Who do I have from? I have Celine, Tavia, Lakeisha, DeChantel, Abigail. All right, so that's when yours is going to be scheduled. Orange Park, your PN 208. Okay, Monday at 3. All right, next is bless you, whoever that was. Pensacola. Let's see when Pensacola is. Pensacola is also Monday. Okay, so I have Danielle, Virginia, Alicia, Jatarius, Stormy, and Vanessa. You guys are all, it's going to be scheduled again Monday at 2:00. Okay. And again, I'm just providing you dates. It's up to you guys to schedule when you should be able to schedule, hopefully this week. We're in week 9. And then my last campus is Port St. Lucie. Let's see when those are. Okay, looks like Port St. Lucie right here is Tuesday. Who do I have from Port St. Lucie? Just Tiara.
Yeah, just me.
Tiara, do you see that?
Yes, I see it Tuesday at 1.
Tuesday
Thank
at
you.
1. Yeah. So there's all your times. Okay. But like I said, all I can do is provide you days and times. I have nothing to do with the scheduling. All right.
You
So
said Cuyahoga Falls was December 11th at 8 a.m.
Oh, Kadisha, let me go back. I can't remember. That's all right. Cuyahoga Falls. There you are. 3 p.m. See it? 2:08, 3 p.m.
Got it.
All right. So at least I can provide you the days and times. So for planning. And hopefully your campus will be reaching out to you to get yourself scheduled, but it's up to you to get yourself scheduled. All right. So that's number 1. Number 2, I sent you out. Okay. Let me go back. All right. You guys can see my screen. I sent you an updated HESI review, exam 3 and HESI review schedule yesterday. Okay. So you've got, this is for next week. No, this is for this week. HESI reviews. Why didn't it come up all the way? Where is it? Oh, okay. So HESI reviews are this week. Exam 3 reviews are this week. Okay. I'm doing mine tomorrow at 3 p.m. Professor Ford's, she changed hers. That's why it's in yellow. She's doing hers Wednesday morning at 10 a.m. Eastern time. And then Professor Kershaw is doing hers Sunday at 6 p.m. So you got a Tuesday, Wednesday, Sunday, 3 opportunities to attend exam 3 reviews. And then your HESI reviews are also on here. So that would be for next week. I know you have exams next week, but there's also 3 HESI reviews. Okay, I believe I do mine on Tuesday next week. And then you've got actually you've got one coming up this Sunday, and then Tuesday, and then the following Sunday. Okay, so have a look at that. That's why I sent it to you, so you could try and plan ahead. All right, so those are your schedules. All right, next is who's coming in. Next is the big announcement I sent to you guys yesterday. It's the roadmap. I hope hopefully this was helpful to provide you for the next several weeks. Okay, so let's just review this. Or first of all, does anybody have any questions about this? It goes through the rest of the term. Okay, so we're now in week 9. Okay, you have several things due this week. You have your NCLEX. These are all due Sunday. All right, Sunday the 3rd. You have your NCLEX. You have your case study. And you have your, pardon me, you have your HESI prep assignment. Okay, those are the 3 that are at their 3 assignments due. Okay, and then if you can, try and attend a live review session for exam 3. Okay, and just to jump into today we're going to, I want to review this announcement that goes through the next 4 weeks. Then we're going to do our review of the 2 concepts to be covered today for week 9, and then that's it. That's it with content. And then I would like to, I'm kind of torn between doing presentations from your paper or jumping into the study guide for exam 3 and trying to fill that in. What would you like to do?
Study
Tell
guide.
them to study, guys.
Study guide.
Okay.
Yeah.
All right. So we'll do a good review of the, we'll do a good fill-in of the study guide. And remember the study guide, this is the revised way we're doing it, and this is the reason is to increase your knowledge and critical thinking. So as you go and look at the concepts, you look back on what did I learn about the concepts and what am I going to be tested on? So we'll get to that when we get to the study guide. Okay, so that's for this week. So next week is your exam week. All right, same as exam 1 and 2. You take it during your scheduled class. Okay, hope to have the exam grades posted Saturday, like I've been doing. Okay, I can't give out any preliminary information. And then remember, a week from Sunday on the 10th is your vulnerable populations. Right? I have had several people turn it in already, so that's good. And I've had several people turn in the HESI prep, so that's good. That means you've been working on this. That's great. And then next week also is HESI reviews, if you'd like to go to them outside your exam. Okay. And then the week of HESI, your attendance, and I put this at the bottom of this email, or right here, your completion of your HESI means that you attended week 11. There's no class. There's no class during week 11, right? You're taking your HESI. All right, so that's your attendance. And then my suggestion is that you get going on your remediation as soon after you finish the HESI as you can, because most of you are going to have three sets of remediations to do. Okay. I have down at the bottom here, just so you know, here's where it says updated remediation guidelines. I gave that to you now. Okay, so everybody, what does this mean? You guys tell me what this means. You've seen it before. What does it mean?
Whatever we got wrong, we go over and learn the concepts that we got wrong on the exam, on the HESI,
Mm-hmm.
to help us understand better.
Yep. So while this is pulling up, this is the hours required for remediation based on your score. I don't know why it's not coming up. I can pull. All right, there you go. So it explains what remediation is. And it gives you your hours. So this is whatever you score in your HESI. This is the number of hours you have to complete of remediation. You're given case study, you know this, case studies and concepts to look at. Okay, so that's what that is. All right, that's your remediation. Then I provided you here your week 9 blueprint concepts, which we'll go over in a little bit. All right, so let's go back up here. Week 11, you'll be taking your HESI. Now you do have until the Monday of week 12 to complete your remediation. I would highly suggest you not wait until that Monday, because if something goes wrong and you can't complete it, there's no exceptions, no late extensions. So my suggestion is to get going on your remediation as soon as you can. Then week 12, okay, hopefully you caught this if you read this. We do have class in week 12, believe it or not. I know you're done your HESIs, I know you're done all that, but we have to establish attendance. This is just a real quick get on. We'll talk about any concerns you had about the HESI. We'll talk about any end of the term advising. You just have to come on. I mean, last term it was maybe 5 or 10 minutes. All right. It's not a full class at all, not even close. But you have to click on to get attendance for week 12. So if you already have a high percentage of class missed, you got to come. You got to check into class, because this could make or break. You know, if you get above 20%, that's a full letter deduction, right? So I just want to remind you of that. Week 12, we will have class just for a couple of minutes. All righty. Anybody have any questions about our roadmap?
No,
Nobody has any questions. Okay. You guys getting your assignments done?
yes, ma'am.
This is a busy couple of weeks for you guys. Weeks 9 and 10 are the busiest of the terms, busiest weeks of the term for you guys. Okay, let's go over our week 9 concepts. You guys, probably not. Can you guys see my screen now?
Yes.
Okay. So the 2 concepts to finish out the term are human abuse and violence and cultural influences in nursing. I've actually talked about cultural influences throughout the whole term. So this will be the kind of the finale of it. What do we know about human abuse and violence? What do you guys think? As you're preparing for this class, what did you learn? What did you learn about human abuse and violence? Does it seem to increase in? Go ahead.
Sorry.
Go ahead.
It usually stems from like a young age sometimes.
Mhm.
So like from when they're children, something happened to them in their childhood.
Okay. Yep. What else? Go ahead, Abigail.
Parents who are stressed financially or substance abuse, they can abuse their children.
Yeah. Human abuse comes in many, many different ways, right? Child abuse, child neglect, domestic violence, intimate partner violence, family violence, trafficking, right? Prostitution. Human abuse is rampant, right? They say that violence is a maladaptive coping mechanism, right? It's much more common with vulnerable populations. just like substance abuse is, just like mental health issues are. Okay. Violence is a means of trying to exhibit or regain control. Okay. In your nursing career, you're going to be working with a lot of maybe victims of human violence, perpetrators of human violence, witnesses of human violence. I dealt with a lot of that in the schools. Okay, these kids were witnesses to a lot of violence. Okay. Typically, people who do become involved in violence or violent behavior had some, like Glenisha said, had some exposure to violence. Okay. They were often beaten when they were children. Maybe they witnessed siblings or one of their parents being beaten. Right. And they learn that violence is the only way to manage conflict. Right. Lots of things contribute or are risk factors for violence, right? Poverty, chronic stress, comorbidities, obesity, chronic diseases, diabetes, hypertension, cancer. Okay. We know, right? You all know that we're mandatory reporters, correct? What does that mean? What does mandatory reporting mean?
You have to report
Yeah.
if you see any signs of abuse and neglect.
Is that just with kids?
When children were
No.
elderly.
Older adults too.
Older adults. Is that at work? Just at work?
Anytime.
Anytime, anywhere, right? Grocery store, playground, local rec center. Okay. Children are very, very at risk that are exposed to violence. Okay, they're at high risk for mental disorders, self-harm, substance abuse, and attempted or completed suicide. Right, and the mental health, we're trying, but there's very limited mental health resources for our kids. Right, we saw what happened during the pandemic when these kids were isolated, socially isolated, right? Out of school. Okay, the risks of violence and suicide went way, way up. We know that abuse is about power and control. Okay, generally, when we talk about family violence, what that refers to is violence among the most powerful against the least powerful. Right? Family violence, just going through the notes here. Family violence is perpetrated in a cycle. As children growing up see violence used as a method to control over children or spouses. All right, we know that abused kids are much more likely to perpetrate violence or tolerate violence in their own relationships. They grow up thinking this is the norm. Right? Families living in poverty or economic challenges, maybe an unplanned pregnancy, unemployment, marital difficulties, infidelity, all likely to have a higher risk of experiencing violence, social isolation, right? Just talked about that. Elder abuse is huge, right? Elder abuse within the family home, within the elder's home, within a facility, long-term care facility or rehabilitation, right? We have to be able to have assessment skills to be able to ascertain whether the elders that we're caring for are experiencing any kind of neglect or abuse. Okay. Victims of violence exhibit symptoms. Kids are more prone to frequent headaches, stomach aches, bedwetting, anxiety, depression, withdrawal behavior, inappropriate sexual behavior, or knowledge. Saw this a ton in the schools. A lot. Kids bring a lot to the schools. Okay, and teachers, administrators, nurses, aides can pick out the abnormal behavior or the sudden change in behavior. Really important to pick that up in the school setting. Okay, another kind of violence is called intimate partner homicide or intimate partner violence. Okay, that typically happens when there's been a previous domestic violence incident. Okay, then the risks increase for intimate partner homicide as the access to guns increase, right? Estrangement, maybe using weapons, maybe non-fatal strangulation. Intimate partner homicide, intimate partner violence is very detrimental to the kids living in the home. And it's also very detrimental to the victim of that abuse, right? What about abused women? Chronic headaches, palpitations, sleep and appetite disturbances, maybe sexual dysfunction, IBS, UTIs. And then we also know that violence tends to typically increase during pregnancy and especially during a teen pregnancy. We talked about that when we covered teen pregnancy. Elders are at risk for multiple kinds of violence: physical, emotional, financial, as well as neglect. Right? What kinds of emotional abuse for elders? Maybe demeaning them, affecting their self-esteem, maybe name calling, scaring them, embarrassing them, destroying their property, not letting them see family and friends. Maybe neglecting basic needs: food, housing, clothing, medical care, or ultimately abandonment. Okay. Another form of violence is suicide. Suicide is obviously a self-directed form of violence. It's the second leading cause in the death of young adults. Okay, what are some of the risk factors? Depression, mental disorders, substance abuse disorders. Maybe family history of suicide, family history of mental illness, family history of substance abuse, family history of violence, firearms, incarceration. Okay. As far as primary prevention, some things that primary prevention in the schools, we'll talk about school-based education. So remember, primary is prevention. Not only are we working with kids, we're also working with parents. Some ideas, you're going to get asked about this. Okay, primary prevention. What can we be doing for the kids and the parents? Teaching parents good coping skills. Teaching parents anger management programs. I know when I was in the schools, we did a lot of education with the students, but we also did a lot of education with the parents. Okay, maybe home visitation programs for families that are high risk. Okay, this would actually be a secondary, right? Home visitations for families at risk who have identified a family or child at risk, right? So home visitation, right? That would be a secondary. Maybe parents that have low social support, parents that have a history or active depression, have multiple stress factors, history of abuse. Maybe they're more at risk for abusing their own children. Right? And if you go back and read through chapter 45, you've got a few pages to read in there. Okay, that's read through those pages. Okay, that's where a lot of the trauma, shock, violence, that's where that is. Okay. Then the second concept is cultural influences in nursing. We've talked about this through the whole term. Right? Culture, culture, your culture, my culture, whatever culture we're talking about is a set of beliefs, right? Set of beliefs, values, assumptions that we pick up through our socialization of childhood, right? Many different cultural groups, ethnic groups, right? We may have a lot of similarities, but we're also unique because we have a lot of differences. Things that we need to consider with different cultures: language, touch, personal space, body language, perceptions of health and illness, family structure, childbearing practices, time orientation, end of life conversations. Every culture looks at all these things differently. There are similarities, but every culture has their own unique beliefs and values and practices. One of the things as nurses we need to try and do is incorporate, and I've said this before, as we look at each client completely unique and try and learn their culture through conversations, through observations, through assessment, right? We need to try and incorporate as much of their cultural values and beliefs and practices into the health plan for them. Whatever we're developing a health plan for, whether it's a family member who's sick in the hospital, whether it's a family you're working with in the community, whether it's a client in a rehabilitation facility, we have to try and consider all those different things in their plan of care up here. What is their cultural belief about touch, about language, about personal space, about food preferences, right? We talked about this last week. Trusted community members. Who are you going to reach out to in the community if you're working in a community that has a variety of different cultures and there's a language barrier or a cultural awareness barrier, right? Reach out to your community members. They can help you develop a plan that's best suited to meet this particular culture and the needs of this culture, right? Community leaders do know best how to reach their members in a culturally appropriate manner. As nurses, we need to maintain an open and objective attitude towards individuals and their cultures. A couple things we need to do. Okay, we need to avoid seeing all individuals as alike, because no, we're not alike. Everybody is unique. We need to not project our own culture on others, right? We all work with people who do that, do we not? We definitely do. Cultural awareness, it's our own self-examination and exploration of whatever biases we have, any prejudices that we have. We need to work on that individually before we can take on other cultures, right? And then lastly, cultural competence. Finally, at the end, when we've practiced all of our cultural awareness, cultural knowledge, accepted our biases or prejudices if we have any, we ultimately need as nurses to develop cultural competence, not just as nurses, really in life, right? Because we're all living in communities with many diverse cultures, right? So to develop our cultural competence, we need to be sensitive to different cultures, cultural implications during each encounter. Can't be stereotyping based on ethnicity. If we don't know about the culture, ask. Stimulate your own learning. Ask about their culture. Avoid making assumptions, avoid being judgmental. If we need to and we have availability in the hospital setting or whatever facility setting, we can always use interpreters if they're available. Okay. So cultural, the ultimate, let me ask you guys, what have you done? I want to hear from people. What have you done to improve your cultural competence? Because ultimately in nursing, we have to be culturally competent to work in the current workforce. What have you guys done to improve your cultural competence? Abigail, I'll start with you. What have you done?
I guess read and learn about the different cultures.
Mhm.
Then
When you come in contact with different cultures and you're unfamiliar, Taylin, what do you do?
I guess you could always like ask questions before you do anything to somebody, or after you're done like talking to them, look things up so you know that you're not being disrespectful or rude.
Right? Tiara, what have you done to improve your cultural competence?
Well, I've been reading like in my med search book, and then I'll use my HESI PN book as well to understand it more and get a
Okay.
better breakdown.
Okay, great. So Stormy, you stumble upon a client who has a different culture than you're used to and you're not familiar with it. What are you going to do?
First, keep an open mind and ask all kinds of questions and, like respect their boundaries, and you just don't judge them. You're there to take care of them and you need to be respectful. And also, like, it's interesting to me, like, since I've started nursing school, I have learned a lot of different cultures and the way that they do things. And I think it's really cool. So.
Right. Virginia, what about you? What have you done to improve your cultural competence?
Where I live at, it's a lot of Indian descent,
Okay.
like
Okay.
travel. So we see more of that than most anything. So I've just kind of just been studying in more on what they believe in and how they want to be treated.
And what have you learned about the Indian culture?
More so like they don't typically just come. Usually if they come, they're actually really, really sick.
Yeah.
They don't just choose to just get up and go. A lot of it's like herbal medicine. They don't believe in lots of pills, or should I say, like, and it's more like spiritual. They believe in, they'll be healed this way versus going to the doctor or stuff like that.
Absolutely. Great. Great. Vanessa, what about you? What kinds of different cultures have you worked with and how have you educated yourself?
I don't think I worked with different cultures yet, but I know I got to keep an open mind if I do come across it, be non-biased and stuff.
Yeah, so you've had no experience with working with different cultures, huh?
I don't think so. None that affected me.
Okay. All right. Well, you have all the information you need as you move ahead, right?
Mm-hmm.
Tavia, what about you? Is Tavia there? Glenasia? How have you improved your cultural competence?
I pretty much read, and then like my sister married somebody who is Hispanic, so I usually ask him a lot of questions.
Great.
And I spend a lot of time with their family. It's usually parties, but it's different, and they're learning English too, so we kind of share language a little bit. I'm not very fluent on Spanish at all, but I try to pick up on different things every once in a while.
Yeah, that's awesome. That's great. Celine, what about you? Have you worked with any different cultures?
Yeah, what everybody of you guys,
You what?
what everybody else. So
Yeah.
I'm from Mexico, so
Right?
I've been here for not too long, around 2 years and a half now, three.
Uh-huh.
So
So you're actually learning about the American culture.
yes, asking, breaking the ice, not be ashamed, be
Yeah.
respectful about the belief of the others,
Yeah.
learning about the diversity of the others' cultures.
Oh, that's fantastic. That's fantastic. Lakeisha, how about you? Do you work with any different cultures, any different populations, whether it's coworkers or clients?
Yeah, I had a client who really didn't speak English, and honestly, I didn't understand her. So I just try to I use hand suggestions, like, or I'll say I don't understand,
Okay. And how did,
and
and
she'll like show me, or
okay.
I'll go get someone who can speak Spanish
Exactly.
to translate.
Exactly. Exactly. Did you learn a lot from,
Kind I mean, I didn't really like hold conversations. It's just if I went in her room and told her like I'm coming to check you to change because she was incontinent,
uh-huh.
and I asked her, did she need anything else? Because I don't want to just go in there, change her, and then leave, and she might,
Right.
like,
And she has no
because
clue what
some
you're
people,
doing.
they don't
Yeah.
understand the patient, they
That's
don't
exactly
bother
right.
the patient. Yes,
Yeah.
and
Great.
she smile and stuff like that. So I
But
guess
she may smile, but how much does she understand?
that I don't know.
Exactly.
I have to get somebody who can. But thank God we do
Exactly.
have a couple of people there who can speak Spanish. So
Yeah.
and she'd be
Yeah.
more excited when somebody come in her room who can speak Spanish.
I'm sure. I'm sure. And remember when we talked about
Yeah.
how do you assess
So it can be difficult.
it can be very difficult. How do you assess whether they're acknowledging even what you're saying if there's that language barrier? Kadisha, what about you? What's your experience with different cultures? How are you improving your cultural competency?
I work in a nursing home, and it's this couple that lives there, and her husband is her interpreter.
Oh,
So sometimes she gets a little frustrated. Her husband has dementia, so sometimes she gets frustrated because he doesn't really relay the messages correctly as she wants
yeah.
him to say it or whatever. But she's not fluent in English, but she knows a little bit. So and then we do have an interpreter there, and then she was just stating how she just felt like that the A's were showing her husband more favoritism because he knows English and
Yeah.
she doesn't. So every time I for me, I just like to be patient with all my residents or whatever. So I'm patient with her and I try to listen to her. And the nurses even notice that she gets excited when I come in because I understand, like I don't understand what she's saying, but I know what she wants, because I'm
Right.
patient and body language
Yeah, you're
and
getting to know
just
her.
she could point to things or whatever, and she could speak
Yeah.
a little bit or whatever. And even if I don't know, I just try to put it together and say that. And then she's like, yes, yes, or whatever. And she always be like, I love you. So
Oh,
I don't know,
oh,
just being patient, reading their body language and things
yeah.
like that for me, you
Well,
know.
think about it, you guys. Think about you traveling to a different country.
Mm.
Think about it. You're by yourself, or maybe you have a family member with you, or you're by yourself. You don't know the culture, you don't know the language, and you get sick. And you have to go into urgent care or whatever they call it, emergency room, or you're admitted into the hospital in a different country. Nobody speaks your language. Nobody understands you. What do you think? I mean, put yourself in that situation. What are you gonna do? Right? I mean, it goes both ways. And that's why I don't know if it was a quiz question or maybe maybe it's part of the cultural competency, but putting ourselves in somebody else's shoes. Think of their think of the fear. Think of the anxiety. Think of the stress of being in a place where you can't speak the language, your caregivers can't speak the language, but yet you're supposed to get better and go home. Which is why cultural competence is critical, right? Cynthia, what about you? What are your experiences? I bet you have some. I know you
Yeah.
have some.
Definitely because we are an international congregation.
Right.
So we have access to several cultures, different languages, different even different cultural ways of living and dealing with things. So I personally have confronted this matter twice, even though we are all Arab sisters, but the differences between the Arab countries also is very different.
Right.
So the Syrian sisters are different than the Lebanese ones, even with the dialect, even with the words. Some of the words we use, they might understand or interpret as a curse or something.
Yep.
So,
Cynthia, tell the group about what you do. Your story is fascinating. It's fascinating. This is Sister Cynthia. Sister
Yes.
Cynthia, tell us what you do.
I am a religious nun. Not as the nuns you know here, because I've heard a lot of stories. I am from Lebanon originally, and I used to live in a convent where we used to work everything handcrafts and embroidery and everything like this. And I have made a farm once COVID hit, just to help sustain the convent. And I created a biogas digester, even though it was not my major. So we started producing methane gas for cooking out of the manure from the goats. So that's who I am, and that's what I do. I enjoyed doing this. And now at our assisted living in North Jackson, I'm here to assist our elderly, in their daily living and help the aides, help the nurses, help the sisters run the mission.
Fantastic. That's awesome. I mean, think about all the cultural exposure Cynthia's had.
Yeah.
I mean, think about it. It's incredible. Incredible. Thanks, Cynthia, for sharing. I think your story's fascinating. Fascinating. DeChantel, what are you up to with tell me about some cultural experiences you've had in your workplace, in your life. What different cultures have you worked with?
Mostly, I would say all. I worked with some Spanish people before, Filipinos, and some from Budapest. But we didn't have a language barrier because they was actually bilingual, so they was able to communicate with me. Now, I did have one instance with a Spanish lady, and it was terrible, honey. When I say we played charades the whole time, I tried to take care of her, and it was very difficult because from me observing her, I could tell that she was in pain, but I could not make out what she wanted. It was at assisted living in St. Augustine, and that was like one of the worst cases because I wanted to provide her the help that she needed, but we could not communicate. I didn't know what the lady was saying.
And was there nobody to help you?
No, it wasn't. But I think I remember it was like one housekeeper that could speak like a not necessarily the language that she knew, but kind of like she can only make out certain words, certain phrases. So we were still limited.
Think of how that client felt. I'm just talking to everybody now. Think about how that client felt. That DeChantel was talking to, that trying to, I'm trying really hard to figure out what's going on, but look at the language barrier. Look at all the problems it created for both DeChantel and the client. Cultural awareness and cultural knowledge and cultural knowing about cultures is critical, not only now, but going forward. What about you, Jatarius? What are you doing to improve your cultural competence?
Just researching, studying.
Do you work with any different cultures? Or any
No.
people?
I
Really?
mean, I
Okay.
came across one patient at labor, labor and delivery,
Okay.
and she refused like pain medicine, but you could tell she was in pain,
Yeah.
and she just kept saying she 0 out of 10. I think
Yeah.
she was
What
Vietnamese.
culture was she?
Vietnamese, I think.
Vietnamese? Who knows? I mean, maybe the Vietnamese culture doesn't believe in pain medication during delivery or
Yeah,
epidurals or whatever.
the nurse said that when they're around their husbands, they try not to show pain or something like that. So you have to talk to them one
There you
on one.
go.
Ask the husband to leave the room.
Yeah. It's crazy, isn't it? I'm
Yeah,
not saying that's bad. I'm not saying that's bad. I'm just saying it is mind-boggling how different cultures are. And
right.
you all going out to the field and working in the nursing profession are going to be exposed to a variety of different cultures. I'm sure when DeChantel was taking care of that client, it killed her to see the client in pain and knowing the client was in pain, but couldn't find the means to communicate to figure out how to help her. Right? Tavia, what about you? You need to turn your camera on. Okay. Tavia's not there. So cultural competence. That's part of the foundation of our nursing profession going forward. Everybody's different. Everybody's unique. Everybody's from a different culture. You may work with people who are from different cultures and do things differently. If you're caring for clients, you may have family members that are from different cultures. You may maybe have teachers of your kids from different cultures. And think of all the diversity in your kids' schools for you guys that have kids in schools. Cultural diversity is all around us and it's not going anywhere. So we need to keep an open mind, right? Open mind, open heart, openness to so many people that are coming into this country that are language, financial barriers, language barriers, right? Don't understand our healthcare system, don't understand what is available to them. Lots going on. Okay, let's jump to our your study guide. Let's talk about all these concepts. I'm looking at a different screen. So if I'm looking away, I'm looking at a different screen. Okay, so I'm going now back to week 7. Okay, our concepts were infectious disease prevention and control, HIV. Well, let's just start with that. What do we remember about infection? What do we need? What's important to understand about infectious disease prevention and control? What do we learn? So remember, concept-based learning is building on what you already know, right? So you have had an introduction at some point during your classes prior to this class about infection control, infectious diseases, communicable diseases. So concept learning is based on taking what you already know and moving it forward. So what's important to know about infectious diseases, communicable diseases, control of infectious diseases or communicable diseases? What do we want to know?
The isolation precautions and things like that, washing your hands.
Take notes, guys, because you're building your study guide. Take notes. Go ahead,
The way of
Kadishia.
transmission,
Pardon me?
the way where these diseases are transmitted.
Transmission, right? The few infectious diseases we talked about were hepatitis, What do we remember about hepatitis? We need to know about hepatitis. What do you guys remember about hepatitis? Is it viral or bacterial?
Viral.
It's viral.
What is it?
Viral.
Viral. So is that treatable?
The symptoms, but it's not curable.
Not curable, yeah.
Symptom management. All right, remember we have bacterial infections we can treat with antibiotics. We have viral infections that are symptom management. Okay. Remember, there are federal mandates of what has to be reported, right? The CDC maintains a federal database on what infectious communicable diseases have to be reported. Those then filter down to the states, and the states can add to it. They can't delete it, but they can add to it, which factors right down to the local level. So when I was in the schools, we had a big binder of the health department's requirements for reporting. What do we have to report? The nurses have to report it, the schools have to report it, the hospitals have to report it, the doctor's offices have to report it. Let's say you had pertussis or whatever. What I need you to know is that there is a list of reportable diseases that must be followed. Okay, that's part of infection control prevention. Think of the pandemic. Think of COVID and everything that had to be reported. Right? Okay. Okay, let's talk about the epidemiological triangle. What's that?
Agent, host, environment.
The host, agent, and environment.
Yep. And what's the agent?
The disease.
The cause of the disease.
Yeah. Is it a bacteria? Is it a fungus? Is it a virus? Is it a chemical? Right?
Anything.
What?
It could be any of those bacteria.
Any of them. Yep. And then the host is what?
The reservoir.
It's us.
Or curates various us.
It's the live human that is infected, right? Let's say, well, there's a lot of differences with hosts. We're either healthy or we're unhealthy. Like right now, I'm pretty unhealthy. So anything that comes my way, I'm going to be at higher risk for getting, right? When we think back on the pandemic, we talked about this in class. Let's say your host, let's say COVID, your host was healthy kids in school versus elderly in a nursing home. Does it make a difference?
Yes.
Of course it does. Right? Remember the elderly that may have comorbidities, they may be less healthy, may be more susceptible to getting sicker from a COVID than, say, a high school class. So the host you have to think about: healthy, unhealthy, obese, comorbidities, family history. All those kinds of things affect how they are going to react to whatever that agent is. Maybe people who get the flu shot are going to be less resistant or get less sicker if they get the flu, or if they've had the flu vaccine. Right? You understand what I'm trying to say here, right? It's a variety of differences how the host is going to react to that agent. Lots of factors involved. Same with the environment. Okay, the environment creates certain factors that make it more healthy, less healthy. Right, so you've got to think about the environment. Let's say people work in environments that are extreme heat or extreme cold. That may impact certain agents, certain hosts. So remember the epidemiological triangle, the agent, host, and environment, all are dependent upon each other. Right? There can be a million different scenarios that come out of something. Whether it's flu, COVID, pertussis, chickenpox, strep, doesn't matter. Okay, so that's what I want you to know about the epidemiological triangle. Hepatitis A, B, and C. What's hepatitis A?
It's transmitted fecal oral to fecal.
Fecal oral. What's hepatitis B?
With blood. transmitted from
Bloodborne.
blood.
Yep. Who's more at risk for hepatitis B?
The
IV
transfusion
drug users.
people.
Yep. STDs, somebody with chronic STDs, multiple sex partners, right? IV drug users. What's hepatitis C?
Food.
Bloodborne.
Still bloodborne,
Yeah.
right? But remember, hepatitis C can be create much bigger problems for the pregnant mom, right? Remember, hepatitis is viral. There's no cure. Okay, tell me about smallpox. What do we want to know about smallpox? What are some of the early symptoms of smallpox?
Fever.
Fever?
Rash. Skin
Rash?
soil.
Yep. Head and body aches. Remember, let me just take a break here. As we're talking about all this and going through this, all of what we're talking about is back in your notes, right? So make sure you are reviewing your week 6, 7, 8, 9 notes. Okay, this is what I'm looking at right here. I'm just reviewing with you. That's why I'm looking away. I'm looking at what you already have. So that's why I need you to review. What's the difference? How do you tell the difference between smallpox and chickenpox? What happens in
Smallpox can turn
Go
into
ahead.
craters, like deep craters,
Yep.
or they're on the palms of the hands, soles of the feet.
That's the key, what Abigail just said. Palms of the hands, soles of the feet. That's where you see smallpox. You will not see that with chickenpox. So if you're asked, there are questions about smallpox on the exam. So know that. Okay, and review your section in week 7 on your notes about smallpox. Smallpox contagious? Yes.
Yes, very contagious.
Yes, very contagious. Okay. Is smallpox viral or bacterial?
Viral.
Bacteria.
Smallpox is bacterial. So it can be treated with antibiotics. Right? Next infectious disease is syphilis. Gotta know about syphilis. What do we need to know? How do you identify a potential syphilis case? It may begin as a pain. Go ahead.
It begins as a painless sore and
Yep.
then
Yep.
moves into
It moves-
flu-like symptoms.
Yep. It moves right through your lymph system. Right? Syphilis. Okay. You may not, and it has different stages. You may not even get a positive blood test, positive serology test until the second stage. It may not show up in the first stage because syphilis comes in stages. Okay, but you may not get a positive test until your second stage. If it's not treated with antibiotics in the primary or secondary stages, there's a good possibility it will become latent. Okay, may become latent and reemerge in later parts of life. Okay, and at that point, it's not bacterial anymore. Right? If it's not treated in the primary and secondary stages. The next infectious disease we talked about is herpes. What's herpes? Viral, bacterial?
Viral.
Viral. Yep. What do you know about herpes? It's viral, right? Always contagious, right?
Yeah, and the lesions appear under stress, fever, infection.
And a lot of people think of genital herpes when they think herpes, but genital herpes is just one type of herpes. Herpes can appear anywhere. Right?
Yeah.
Blisters that last for several weeks, Virus moves into the nerves. That's your shingles, right? And reactivates. My daughter from the chicken pox when she was a baby, she's now in her 30s. She breaks out with a shingle every year on the side of her eye. That's actually, she has a scar from it. Every year in the month of October, she gets a shingle. Every single year. Isn't that crazy?
That's weird.
Yeah, yeah. It can be suppressed with antivirals, but no antibiotics because it's a viral infection. Okay, the next one is HPV. What's HPV?
Herpes.
What is it?
HPV.
HPV.
It's human papillomavirus.
Correct. Correct. You can get HPV by having vaginal, anal, oral sex with somebody who has the virus. It's very contagious. Okay, that's how it's most commonly spread. Okay. Is there a vaccine for HPV? Well, let's go back. Is there a vaccine for herpes?
Yes.
Herpes.
For herpes, no.
Is there a vaccine for hepatitis?
Yes.
Which hepatitis?
B.
Exactly. Okay. HPV, there is a vaccine.
3 doses.
Right? 3 doses. Exactly. Recommended. Safe and effective. Okay. All right. So that's the first concept. The second concept we covered in week 7 was bioterrorism and disaster. What kinds of disasters do we see? There's 2 types.
Natural and
Okay. What's an example of a natural disaster?
like a hurricane,
What else?
tornado.
Earthquakes,
Earthquakes, yep.
epidemics, maybe communicable epidemics, droughts. What about a man-made disaster? What's that?
Fires.
Oh, that's
Water pollution.
Fires.
Maybe wars. Things that we create. Right? Pollution, warfare, fires, water contamination, air pollution.
Sound pollution.
Pardon me?
I say sound pollution.
Yeah. Remember that nurses are expected to be able to function in any stage of the disaster, right? Whether it's in the preparedness stage, the preparation stage, the actual disaster, the recovery from the disaster, and the go forward planning, right? We may be asked to prepare families in the case of a disaster. Remember that kit that we might help them put together? What are the 5 most important things to know about putting that kit together? Food for how many days?
3 days.
3 days.
Okay. What else?
Recheck it every 6 months.
Yeah.
4.
To make sure nothing's expired.
Okay.
Is just
Make
like
sure
your
all
medicines
members-
included in that? I'm sorry.
Okay. Yep. Go ahead. Yep. What about, does everybody need to know where the kit is located?
Yes.
And what does everybody else need to know as well?
How to turn off all utilities in the house.
Turning off all the utilities. You're going to get asked about how do you prepare a kit. Okay, what's most important? We just went through it. Okay. Water can be considered safe by drinking. So take notes. How is water considered safe after a disaster? Couple things. Boiling for 3 to 5 minutes. This was in your readings. I'm just reviewing it. Boiling for 3 to 5 minutes. You can add 1 mil of bleach to a gallon of water and let it stand for 30 minutes.
Water boil for
What?
how much you say? How long need to be boiled?
3 to 5 minutes. You can add 1 ml of bleach to a gallon of water. Let it sit for 30 minutes. This is how we get to water that can be considered safe to drink. And remember, we've got to be draining the water from all the hot water heaters. That is contaminated water. Okay? To talk about some other things. If a chemical spill has occurred, how do we remove the clothing?
With water.
What do you use?
Tongs.
Right? Here's a couple of different bioterrorism agents. Let's say it's a vesicant agent, an example like mustard gas. What is that going to affect? What system? There's 3 different ones. There's a vesicant, a nerve, and a blood. Let's go over these. Your vesicant agent is your mustard gas. It's going to affect ocular, so your eyes, your skin, and your respiratory. That's in your notes. That's in your week 7 notes. I'm just reviewing it. You might take care of a client who's been exposed to a nerve agent. Let's say sarin gas. What systems are going to be most affected?
Respiratory system.
Respiratory is significant with the nerve agents, respiratory. And then the third type of agent is a blood agent. Let's say cyanide. What systems are going to be affected?
Their skin.
Skin, definitely. And what's the other one?
Your respiratory.
Respiratory. Okay. You guys getting this? So if your vesicant agents are going to affect your eye, your skin, your respiratory, your nerve agents are going to severely affect respiratory, and then your blood agents will affect your skin and your respiratory. Okay? Guys taking notes? Okay. All right, let's jump into our week 8 concepts. Home care. What do we want to know about home care? What's different? Why is home care different? Where is the care being performed?
In the home.
Virginia, you're on mute.
Oh, sorry. In the home.
In the home setting. Do clients prefer to be cared for in their comforting home environment?
Yes, ma'am.
Of course they do. Of course they do. What's the other significant difference with home care? Are you taking care of a group of clients or an individual?
An individual.
It's individualized care.
No.
Right?
Hey, good afternoon.
Because you're in the home.
Yes, she's speaking.
Okay. What else?
Megan with Angels of Care. How are you?
We always
Good.
does somebody need to mute?
Celine.
Who?
Call about your application.
Celine.
Is now a good time for you
Who?
to talk?
Celine.
Celine.
Celine, where is she?
Okay,
Can't
perfect.
find her. I can't find her.
So I saw that you were
Where is she? I can't find her on my screen.
excuse me, in Jacksonville.
All right,
Celine.
hang on. I'm trying. Celine,
So I-
mute. Okay. Even though I can't see her.
Miss Martin, just to
Yes.
be clear, we are looking at the exam review study guide, right?
Yeah. You're filling it
Okay.
in. We're filling it in.
Because there's no notes. There's just like chapters
I get
and
it.
things
That's
like
why
that.
that's why we're going through it like this, because you're taking notes.
Oh, all right. Thank you.
I'm making you work at it.
I see.
Go back to all of what we're covering right now is all in your weekly notes. Okay. All right. Let's talk about the big difference with home health. It's individualized care and it's in the home. But the other thing to remember is when we're doing home health, we are the client's guest. Right? We go into the home and establish trust, establish a relationship with maybe the client, maybe family members if they're present. Okay, it takes a while to get that relationship going. right? So we have to remember that. What do you do if you're doing home visits with a family, an immigrant family that nobody speaks your language? Nobody understands what you're talking about. What are some things you could do? I mean, now you don't have a big hospital, so you probably don't have an interpreter. What do you do in the home setting? What do we talk about when we're doing our client teaching? Maybe printing things in their primary language, right? Maybe trying to seek the help of community leaders of how to communicate with different populations, right? Home care can be very challenging. Not every household you're going to walk into is going to be free of safety issues, free of environmental issues, free of communication, family issues. And each environment that you go into is going to be different. Each client is going to need different resources. Right? Next was case management. What's case management? What does a case manager do?
They establish systems that monitor healthcare status and therefore high cost chronic diseases.
Yeah, they're the coordinators of care, right? Not everybody needs to be case managed. Okay, let's take a scenario of a person, two people that have had cardiac bypass. All right. One's going home with a supportive family, somebody to cook for them, somebody to drive them to their cardiac rehab appointments, somebody to monitor their dressings. Okay. They're good. Let's say on the opposite side, you have somebody going home that's maybe elderly. They live alone. They don't have anybody to cook for them. They have no transportation. That's the second client is the kind of client you would want to case manage, because that nurse is going to have to coordinate either them going to a rehab facility temporarily, right? Whether it's PT coming into the house, whether it's equipment, if they need oxygen equipment, it's getting delivered. How are they going to get to their follow-up appointments? Maybe it'd be just easier to go to a rehab facility. That's what a case manager does. They coordinate care. And they typically coordinate for more complex illnesses. Maybe ones with comorbidities. Let's say you have somebody with substance abuse issues, alcohol issues, drug issues, and they also have mental illnesses. Okay? Does that make sense? So case management is reserved for your complex cases where multiple people, multiple agencies, multiple tasks need to be coordinated. Does that make sense?
Yes.
Case manager may have to communicate in different ways. Okay, write this down. 4 different ways. And believe it or not, there's a difference. Collaboration. Write these 4 words down, then we're going to define them. Collaboration, assertiveness, cooperation, and compromising. I'm going to be asked about this. So a case manager communicates in many different ways. If you're collaborating, you're working with others to try and come up with a solution that satisfies both people. May not be the best for both people, but it's agreeable. All right, that's collaborating. All right. Assertiveness. Maybe the case manager has to be assertive to present the case, assertiveness is the ability to present one's own needs. So maybe the case manager has to take on an assertive role to get what the client needs. Let's say she's working with an insurance company, right? They may need to be assertive for the best outcome of the client. Cooperation, simply to understand and meet the needs of others. You're cooperating. You're trying to meet the needs of others. And last is compromising. You find a mutually acceptable solution that partially satisfies. All right, so it's compromising. May not be the best ideal for both parties, but we're going to compromise. All right, so there's a difference. And those are different types of communication styles that the case manager may need to use. What else do we want to talk about case management? Nope, we've got that covered. Okay, and then we talked about this week, human abuse and violence, cultural influences in nursing. Top risk factor for intimate partner homicide, previous domestic violence. Write that down. We talked about leading risk factors for suicide and depression. These are all in your week 9 notes. When we talk about different kinds of neglect, I don't know if we reviewed this, but physical neglect in particular, what is physical neglect? How is it different than emotional or spiritual or financial neglect? What's physical neglect?
They're not getting their like physical needs like clothing, food met.
Your basic needs. Exactly, Abigail. Food, clothing, there's 5. Food, clothing, shelter,
medical, health.
Medical and health. Exactly. Yep. And we talked about being mandatory reporters, talked about cultural influences in nursing. We went through all that. And then math questions, 3 types. I think that's on your study guide. Calculating is, these are simple math questions. You got to be able to do these. Calculating a single dose, calculating IV dose over time, and calculating mils per hour. Same kind of questions you've had on the previous 2. Okay. So my suggestion for going back and reviewing for the exam, you just took notes during this quick review. You can try and attend one of the review sessions if you want. I'm basically going to be doing this, what we just did, more in depth. You've got your week 7, 8, and 9 notes. You've got your readings. You've got everything you need to prepare for the exam. Everything. The only difference is you're going to fill in the concept notes versus me giving them to you. Hopefully that stimulates your critical thinking on the knowledge you already have. Okay. Questions? I'm going to give you guys about 15 minutes of the gift of time. How's that?
Okay.
Will that work? Unless you have questions. All right, so go ahead. Anybody have any questions? All right, so we covered a lot today. Hopefully this was helpful to review the study guide, or you guys will be fine. I promise you guys will be fine. You guys are a smart group. All right, I'll stay on for any questions. You guys have a good rest of the week. You have your HESI dates. Reach out to your campus and ask when you can sign up. And then I will see you either at a review session tomorrow. If I don't see you tomorrow, I'll see you next Monday for the exam.
Thank you, Professor. Hope you feel better.
Oh, thanks.
you.
You guys have a
too.
great week. Have a good
You
week.
too.
Thank you.
Yes, Celine, stay on, please.